Hello, City of Fishers. This is Monica Heltz and Dr. Indy Lane here to provide for you a recorded version of the presentation that was given to the City Council meeting on Monday night that a lot of you were unable to hear. We wanted to make this available to the entire community. We also provided a similar presentation to the Board of Health on Friday night. So this is part of the context that led up to our mask mandate. As we're recording this, the governor has just released the information that there will be a statewide mandate as well. So just keep that in context. This is the same presentation we gave on Monday night, so we haven't updated any of the data or the graphs. So I just want you to take that into consideration when you're watching. So the objectives of the presentation are to describe the testing activities that the City of Fishers has been doing so far, to review our testing site data and kind of describe that to you and what that means, present some of our community-wide data that's available for you on our website, and then some that we've compiled in other ways as well, review some of the actions that we had taken so far, outline some of the research that's out there, just a little bit of it. There's lots of research, obviously. We're just going to highlight a few points, and then describe what our further actions are that that need to happen in order to continue protecting the community during this pandemic. So just to start off, this is a graph that describes symptoms as reported on our assessment for people that are taking the assessment the first time before they are tested at our Fishers testing site. So what you're looking at here is the kind of symptoms that people are reporting. We have kind of a triage system for symptoms when you take the assessment. Everyone would fall into the clear bucket if they were having no symptoms at all. And then you work your way up with the most symptomatic individuals and most suspicious for COVID individuals, kind of representing that black color coding. So what this basically describes is that we've seen a vast increase in testing. And then of the individuals we've tested, we've seen a lot more people who are symptomatic, probably a similar percentage. I haven't calculated that out on a daily basis, but since the week before July 4th, we have seen a dramatic increase in testing. This is similar to what's been seen around the state as well. We have also increased our capacity for testing during that time to 240 people a day. So that is a big increase from where we were. And we did that in order to accommodate the need that was, or the testing that seemed to be desired by residents during that period of time. We capped it at that at this point because we frankly have been having some trouble just making sure that we get supplies from the lab and getting our test results back. So we don't want to increase capacity further at this time because of that reason. Right now we're continuously booked about 2 to 3 days in advance for our testing site. So if you're thinking of getting tested and you're thinking you're going to test in the next couple days, I would say do it sooner than later, or sign up sooner than later, because it's going to be a couple of days before you can get in. So this is a dashboard that represents our Fishers testing site data from what we are actually testing at 3 Municipal Drive. So this, you can see that our testing site has tested 5,529 people to date, and those, we'd actually tested more when we updated this, but these are people for whom we have results already. So 5,500 results have been returned, and that represents almost 6% of the Fishers population. So, or you might say only almost 6% of the Fishers population. So not a huge percent of the population that has been tested so far, even though we have tested a lot of people. And you can see here the breakdown between what percent have been positive, what percent have been negative, what percent have been symptomatic if they were positive versus non-symptomatic. So this data is just here for you if this is some interesting point for you that you would like to review. And it's available on our website, and it's updated a couple of times a day. So this is some calculations that we ran based on the based on the testing site data. So this is for our residents that were tested at our site. This is a graph representing the 7-day average for the percent positive. So not only have we seen a dramatic increase in the number of people that have been tested, but the percentage of those residents who were tested at our testing site, a higher percentage of them are testing positive. So this graph only calculates out to the 7-day average from July 14th. So that would be from the 7th through the 14th was where that graph ends, is the average percent positive. So we take the daily percent positive and then we average it out over the 7 days. So at 10%, that is where it is generally recommended that you start shutting things down. So we started seeing this increasing trends, and we became worried because this isn't the direction we want to be headed in. Now, again, this only goes to July 14th. So since then, we've continued to see some increases, and statewide, they've seen similar increases as the governor's update today has reported on. So this next graph, it highlights that same metric. So the 7-day average on the percent positives, and we've kind of put a bunch of different counties up here together. Hamilton County is the red line. This isn't Fisher specific, this is Hamilton County. And you can see that we are doing pretty good compared to these other counties that are around. And we did take, just for context, we did take the highest incidence counties. So we look pretty good compared to them, but if we took the lowest incidence counties, we wouldn't look so good. But you can see that all of these are trending upward in some fashion. And again, that's what the state has presented today as well. The lesson here really is that we never really got where we needed to be before we started opening things up. And even though we were opening up, we didn't keep wearing our masks and we didn't keep doing our distancing. And so we maybe should have used a little more caution in some of those activities. Like I said before, the 10% positive mark is where it's recommended that you start shutting things down. That's the mitigation goal. That's where we were talking about flattening the curve. In order to actually suppress the disease and really get it under control, what we're looking for is that we get below that 3% positive mark on the testing. So that suppression goal assumes that we continue wearing masks, distancing, hand washing, and those measures. But that's where it would be a safer point to get before we start opening up with all those other measures in place. And that means we can really address effectively what the our contact tracing isn't going to involve the whole community. It's going to be isolated incidents of people. Right now, we're starting to get to the point where we're getting back to that more overwhelming level that we were back at in April, where it becomes very hard to get to the bottom of a true situation. So again, concerning trends here is the message on this slide. So this is another dashboard that we have up on our website available for you. This is updated once a day. And again, this slide set was from our presentation on Monday, so it hasn't been updated since then. And this represents our community-wide data. So this is data for our whole Fishers community. So this means that each individual who tests positive, no matter where they tested, will be represented here if they're a resident of Fishers. So each individual who tests positive, I should make the comment, will only be counted once. So even if they got tested 5 times and they were positive 5 times, there's an extensive deduplication process that happens. So each of these represents only one person who tested positive. And if you were looking for the date, since these are by date, that would be the first time they tested positive. After the first time, they won't count them again. So what you can see here is that all total, we have 0.63% of our Fishers population has tested positive. That is a really low number. However, that is basically just the 591 positives divided by our total population of Fishers, which is approximately 93,000 people. You can see the US Census Bureau population data there under that percentage. This is not the percentage we're talking about when we're talking about the 3% suppression goal and the 10% mitigation goal. Those percentages are similar to what that graph was I told you before. You're taking a 7-day average of the percent positivity of your testing that's happening right then. So those numbers will move. This is our total percentage of Fisher's population positive. Again, it looks really low, but it also, I think the other thing we have to take into consideration is that we aren't doing the recommended number of tests to get to those goals either. So just a lot of different factors to keep in mind. That graph on the bottom with the blue bars, that's our daily positives per day. And then the red line going over it is the 7-day average. And that is of numbers of cases, not percentage. So just a whole nother way to look at this data. I would interpret with caution anything in the last 7 days of the graph because the lab results have been delayed by about 7 days. It could be more, so those numbers will change. So if you're watching our website, you may continue to find that those numbers go up as the lab reports for positive tests come in. The other thing I want to mention is the age group. Right now, the biggest increases that we're seeing in cases are coming from our late teen to early 20 age group. And so these individuals maybe aren't getting quite as sick as some of our elderly folks have gotten, but certainly they're very efficient spreaders from what we've seen so far. So I think extreme caution is still warranted. And this data again kind of supports where we are with the numbers. You can see that we're higher than we ever were in April. So this is just another way to look at the data. And again, I don't want to overwhelm anybody, but we are looking at a number of different indicators and measures. There are a lot of places that we go to look for the data. So aside from crunching our own data, we also look at the state website, and that link is available there. The state website also has some additional links to data such as the Regenstrief data, which goes through hospital data, where they really count the emergency department visits, admissions, and deaths, and that kind of stuff. And those are all freely available to the public, so you guys can look at that if you're really interested in looking at a lot of these other measures. And then that picture on the right is from the Harvard Global Epidemics site, and they have some other helpful graphs there. There's lots of other sites available as well for kind of looking through this. What I wanted to point out is that Hamilton County itself, on the Regenstrief data for hospital data, is showing there's an increasing amount of positives, and then what that's leading to then is the next thing that we typically see, which is an increase in emergency department visits. At the point that on Monday, at least when we did this presentation and had this data up here, the admissions to hospitals were steady. That could possibly be untrue today. Those might be rising. I haven't looked at the data on that today, but the state is reporting a definite increase in hospital admissions, and they've been reporting that for a while across the state. Our deaths continue to decrease. However, I would caution you about that as well, because that is a lagging indicator, meaning that it'll take 4 to 6 weeks to kind of catch up to the other indicators that we see. So we know that people often are placed on ventilators for long periods of time, and then the outcomes once on a ventilator are often not very good. So I think just because our deaths are decreasing doesn't mean that we don't need to use extreme caution in the context of all these increasing cases. We know that the deaths will follow, and they may not follow at the same rate that they were in April. We have improved our treatments, but they will still follow. So I just want to make that point. And then as far as the testing, when I mentioned that we should be doing more testing, this Harvard Global Epidemic site that you can see in this little picture, this indicates how many tests a day we would need to do. So in order for mitigation to happen, in order to have that like flatten the curve effect, we really need to have a target for 120 tests per 100,000 of our population. So we have, just at our testing site alone, we're doing 200 to 240 per day. So we're doing pretty good. We're well above, as far as Fishers goes, the mitigation target. But you can see here that Indiana is below even the mitigation target, because Indiana as a whole is only doing 98 tests per 100,000 people. Now, the city of Fishers, although we're doing better than the state, we're still not anywhere close to that suppression target. And there are people getting tested at other places, and we don't have access to the numbers of people that are getting tested at other places. We only have access to the positives that are reported out of that testing. But there's no reason to suspect that it's up to that level, that it would be double what we're doing at our site. So just other things to keep in mind. So the other context that we have here is that in the past couple of weeks, we had the high school athletic teams started practicing, and we've had a number of different cases on those athletic teams. Not all of them required any kind of quarantining for the whole team. However, it has been a bit eye-opening as far as how we handle response with the schools and kind of streamlining that process, and highlights the complexity of trying to figure out how to respond as a community in such large settings like a school setting. These athletic teams are only one small component of what it means to go back to high school and do an investigation for a whole entire high school with all of the things that are going on there. We've also had some summer camps that have been affected. We continue to see workplaces and daycares and other kind of situations where we've had to give guidance and quarantine or isolate different things or shut things down for a short period of time. So just to keep that in mind, that we're not making these recommendations in any kind of isolation of the context that we're in. So these are some of the actions that we've taken so far. We've done some community testing and tracing. We've have developed an assessment tool that businesses can use to assess symptoms on their employees. We offer testing for businesses, for even non-residents of Fishers, if the business wants to sign up for that and pay for that. We've been working on increasing our messaging, partly by having these daily videos. We've been reviewing people's plans to make sure they have appropriate mitigation strategies in place, and including the schools' plans. I've been working with a lot of schools on trying to streamline that. We've had a number of community calls and partnerships with different groups, and then we've been working with groups such as the schools on how to respond when they have a positive. So that's what we've been working on so far. Obviously, there's a lot of challenges with all of this. This graphic on the left is just example scenarios of how to figure out who needs to stay out of school. And I realize that you probably can't see this, but it's on the State Department of Health website. It just is meant to highlight how confusing some of this can be and how challenging it can be for people to sort through the different guidelines. There are a lot of lab delays that we're seeing nationwide, and we're experiencing that from our testing site right now. We're running into capacity limits, like I said, due to equipment, stuff like that we've seen since the beginning. Again, the guidelines are confusing. If you're on quarantine, it needs to be for 2 weeks. And if you're on, if you have the disease, you need to be isolated for 10 days. And the last 24 hours of that have to be fever-free, and your symptoms have to be improving. So all of those calculations really are kind of throwing people for a loop. There's a lot of misinformation out there. There's a lot of stuff floating around the internet and Facebook and everywhere else. And I would really caution you to check the sources of the data that you're consuming and make sure that it's validated and scientific and that it's up to date. So a lot of times we're seeing people quoting stuff from either other years or times at the early part of the pandemic where recommendations were different. As we continue to learn, we continue to try to read the most up-to-date guidance. And, we're willing to say if there's new evidence available that we were wrong on the previous evidence, but we're, again, using the best data that we have available at the time. So we would expect that these guidelines would continue to change over the course of this pandemic. And they have changed, so we continue to see that. We've also noticed that there are, in many cases, a disregard of different guidelines and some of the orders that are out there, the governor's orders. People aren't calling or aren't returning calls from the State Department of Health or for us for contact tracing. They're not letting us know who their contacts are to notify. They're not isolating when they're instructed to isolate. They're not quarantining when they're instructed to quarantine. This is all how we get massive community spread. So we really need the input from the whole entire community to get ahead of this. So just throwing some of that out there for you guys. Okay, one more graph and I'm going to turn it over to Dr. Lane. So this is just some of the studies that you may want to investigate as far as the evidence that's available out there. We know from a meta-analysis recently published in The Lancet that face mask distancing and eye protection are advised. We also know that mandating masks in public correlates with a decline in case rates. So also a very important study in the Health Affairs Journal about a month ago. And then when it comes to schools, a lot of people have questions about schools. There's no straight guidelines for exactly when to open schools or shut schools. There are a couple of different sources that have recommended different things. The White House Task Force, for example, is highlighted here, and they recommend a 14-day downward trend in cases and % positive before you move to the next phase, one of which is opening school. And then I have here just information from the New York State governor's orders about opening schools, because they used a very data-specific approach with a 14-day average % positive below 5%. So that's just another approach to use. Like I said, there's no gold standard for this, so there's no metric to be sure about. We're all still learning. None of us are really certain what the best metric is at this point. So we continue to provide those recommendations to the school, just as far as what other places are doing and what the research is showing, but ultimately that decision at this point is left up to the schools on whether they feel it's appropriate to open at that time. The graph here is a different way to look at those same counties, and you can just see what happens with a mask mandate versus not. There's some contextual factors here that I'm not going to go into, but this is just kind of representing how early mask mandate can maybe decrease cases over the long term. And I'm going to hand it over to Indy.
Thank you, Monica. So a lot of great information. I think that we're exceedingly fortunate to have data specific to Fishers. We welcome Fishers residents to come to get tested so that we can continue to collect this information. I think that what it's important for us to communicate is that we want our businesses to remain open. We want to get back to normal life. But in order to do that, as Monica says, we have to control this virus and the spread. We need to be able to do adequate testing. We need to be able to get in touch with those individuals that are positive so that they can isolate themselves and we can prevent the spread to others. And so in order to do that, I think that we felt it was really important, while Monica and I, as well as the staff of the health department, have been advocating that people wear their masks in public, that they social distance, that they frequently wash their hands. We weren't really seeing that translate well in public, and there were lots of people who, understandably so, were not always good about wearing their masks. And so we felt that the first step in trying to keep our businesses open, trying to move towards schools being open, was to create a mask mandate so that we can do whatever we can to get back to a normal life, and so that we can see those trends that Monica mentioned go back down and stay down, so that we can get this virus under control. So our ultimate goal is to resume our normal lives, but in order to do that, we need the community's assistance with everyone wearing their mask in public, social distancing when appropriate, so that we can expedite getting back to what we all want to do and avoid having our businesses and our schools close. Next slide. Perfect. So again, what we need from our community is that we are, as well as now the governor, requiring facial coverings in public and outdoors when social distancing is not possible. We encourage employer support and flexibility with staff that are able to work from home. If that is an opportunity for some employees, we encourage employers to support that. We want you to limit large gatherings in public as well as in private to prevent the spread. Continue mitigation measures and response plans. We rely on assistance from healthcare providers, providing immunizations in their offices and increasing appointments and testing where appropriate. And then again, community support, distancing, masks, limiting gatherings, answering your phone calls when the State Department of Health or our Fishers Health Department reaches out so that we can find out who you might have been in contact with. So again, we can prevent others from getting sick. Provide the information necessary to reach people, quarantine and isolate yourself if you think you might have symptoms. I think that that's extremely important. If you've been exposed to someone or you feel like you have symptoms, please stay at home. Look to see where you can get testing if you are a Fishers resident. Please go on our website and sign up for testing. There are also, the State Department of Health has multiple sites around the city that you could also get testing if the Fisher site is not an option. And then check on your neighbors and individuals that may not have resources to get out and do things, or who have health challenges that make being out in public risky. It's important that if we all work together, I think that we can get back to our day-to-day life much faster if we consider each other and be sensitive to everyone's needs. So again, we're all in this together. Please stay safe. Please wear your mask and social distance and wash your hands.